Assalamu alaikum. Hello and good evening to everybody that has joined us tonight for the third webinar in the ACPN Headache Patient webinar series. This webinar will be focusing on managing your migraines during fasting, which is very poignant, seeing as Ramadan is coming up very soon. The speaker today is Dr. Taoufik Al-Saadi, the Chief Medical Officer and Chief of Neurology at ACPN. And he will be guiding you through a presentation about managing your migraines during the fasting period. And then after that, we will have a Q&A answer session where you can post your questions and comments in the chat box, and I will put them to Dr. Taoufik on your behalf. If you wish to remain private, you can send it in the chat admin only button, and I will ask that as a private question. If you have any audio or connection issues, you can press the red reconnect button located on your screen, and that will resynchronize your webinar for today. Without further ado, I'll hand you over to Dr. Taoufik, who will begin today's presentation, and then we will have the Q&A afterwards. Dr. Taoufik, the floor is yours.
Thank you very much, Gerard. I'd like to thank all the audience for attending this webinar. With Ramadan coming up in less than a week, I wish everyone Ramadan Kareem, Ramadan Mubarak. And as you all know, with Ramadan coming up, we may face some of the difficulties when it comes down to certain neurological problems, and one of which, the common ones obviously, is the headache ones. And we felt as an organizing and scientific committee, we are obliged to tackle some of the difficulties that our patients may face during the month of Ramadan. So what we'll be doing is we'll be focusing on how we can manage headaches and particularly migraines during that holy month of Ramadan. So let me start off by stating my objectives of discussions this evening. I want to review with you the effect of fasting, generally speaking, especially during the month of Ramadan, on headaches. We want to discuss the non-pharmacological as well as pharmacological strategies that would help us to manage headaches during the holy month of Ramadan. Let me start off by emphasizing on principles that you all probably aware of. In the world of headaches, we have two types of headaches. We have a primary type headaches. Those headaches occur in someone who is otherwise healthy. When we do a neurological examination as physicians, or when we do imaging studies, all these studies are normal, but the patients would have frequent and recurrent headaches. And of those primary type headaches, the most common ones are migraine as well as tension type headaches. On the other hand, when we talk about secondary type headaches, which represent less than 10% of all headaches that come to our attention, these headaches are related to some other neurological disorders, God forbid, tumors, inflammation of the layers of the brain, which is called meninges or meningitis, as well as fasting. So fasting is one of the causes of secondary type headaches. Now, what happened during the month of Ramadan? As you all know that it's a period of intermittent fasting or daily cycles of alternating fasting and feeding periods. During the month of Ramadan, we have two main meals, iftar one as well as suhoor. And the periods, obviously, of the fasting and feeding would vary depending where we are and what time of the year. On the positive side, obviously, when Ramadan comes, there's a time of increasing family bonds. So this is the time where family get together, eat together, try to be together. At the time of a charity, it's also an opportunity to exercise self-control. It's also an opportunity to quit some of our bad habits, especially for people who smoke. It may be an opportunity to think and consider starting the plans of quitting smoking. On the other hand, what happens during the month of Ramadan, yes, we certainly do have less working hours, but our sleep-awake cycle tend to shift, and that would come with certain consequences in terms of worsening some neurological disorders, especially when it comes down to headaches because of that disturbance of sleep-awake cycle. Now, going back to the principles that we had mentioned earlier, we said 90% of all headaches are a primary type headaches, meaning the patient is otherwise healthy. Neurological examination, imaging studies are all normal, and there are secondary type of headaches. And in that study here, this is the study that was conducted in Denmark, it stated that at least 20% of all secondary type headaches are related to fasting. Now, based on that study that I mentioned earlier, which is a review of all the studies that we have so far on the prevalence of fasting headaches, it suggested that 20% of all headaches are related to fasting. And in that review, they clearly had stated that the main reasons for patients having fasting headaches, which again, I will be emphasizing on later during the discussions, why patients would have worsening headaches during the month of Ramadan, mainly is related to caffeine withdrawal or because of hypoglycemia, or meaning low blood sugar. Now, we as physicians caring for patients that come to us with history of headaches, the main way that we can diagnose the underlying reasons why patients would have headaches would be based on history and some of the examination that we do at the bedside. So if the patient's history and the neurological examination suggest that we are dealing with a primary type headache, then we have to think of either migraine or tension type headache. On the other hand, if on the examination or on the history, there's something that is not right, so to speak, then we have to think of secondary type headaches, and that would be the time when your physician is obliged to carry on some additional diagnostic test, let it be CT of the head or MRI, to investigate the cause of the headaches. Now, for migraine headaches, I just want to emphasize the main characteristics of these headaches. These headaches are very important to remember. They usually last several hours, anywhere from 4 hours up to several days. The headache can be unilateral about 2/3 of the time, but it can be bilateral. It has pulsating or throbbing quality. Very importantly, it is of moderate or severe intensity, meaning that the patient during the time that he or she has headaches, they will not be able to function, and the headache would worsen with any activity. So any activity would bring on worsening the headaches. And at the time of the attack, the patient would have either nausea or vomiting, as well as photophobia, meaning they cannot tolerate the sound or the noise as a result of these headaches. There are 3 questionnaires that had been developed that can help us as physicians to screen for migraine headaches. And these 3 questions are based on these 3 important factors, where your activity is limited for more than 1 day over the last 3 months, were you nauseated or sick to your stomach, and did light bother you? If the patient answered 2 of these 3 questions saying yes, then you have more than 90% chance that we are dealing with migraine type headache. Now, what about the other common type of primary type headache, which is tension type headache? The differences between tension type headache and migraine type headaches, that the description of the headache itself is different between tension headache and migraine headaches. The tension type headache is described as pressure, aching, or tightness. Very importantly, it is of mild or moderate severity, but keep in mind that it does not interfere with the patient's daily activity, meaning that the patient during the attack itself, he or she will be able to carry on with their duties despite they having headaches. And that is very important distinction from migraine attacks, where patients during the attack, they will not be able to function, as in the contrary, in patients with tension type headache, they can carry on with their duties without any difficulties. We know migraine is quite prevalent, more so in women as compared to men, is about 3 times more common in women as compared to men. We also know it is more common as well as compared to other neurological disease states. It is more common than stroke, epilepsy, Alzheimer's disease, as well as multiple sclerosis. It is also more prevalent, more common as compared to other chronic disease states such as diabetes or asthma. So it's a highly prevalent disorder. It tends to occur in people in their 20s, 30s, 40s, but it can occur very rarely in those above the age of 50 or in the younger population, meaning those under the age of 15, but very uncommonly. It is a disabling condition. According to the WHO, they clearly had stated that migraine, along with quadriparesis, psychosis, and dementia, are the most disabling chronic condition. And we know if you looked at the years lived with disability, we know that migraine comes second to low back pain in terms of global burden of the disease. And if you look at the segment of people in their productive years, meaning those from the age of 15 up to the age of 50, we know that migraine is the most disabling condition across all the chronic disease states. Now, let's focus now about the fasting headache, which is going to be the core of our discussion, especially with Ramadan, inshallah, coming up in less than 1 week. Now, what happens during the month of Ramadan or as a result of fasting? We may experience one of 3 possibilities. Either someone who previously did not have any headaches, then they will have de novo, meaning new onset fasting headaches, or someone with a prior history of migraine, they will experience worsening migraines or different migraines during the month of Ramadan, or they may have experienced worsening tension type headaches. So 3 possibilities that could happen as a result of fasting, specifically during the month of Ramadan. Now, according to the classification of the International Headache Society, the characteristics or the description of the fasting headaches, it has the following characteristics: frontal location, diffuse, very importantly, it is non-pulsating, meaning it's not throbbing as compared to the pulsating quality headache that we may experience as a result of migraine headaches. It is of mild to moderate severity as compared to, remember with migraine headaches, we said it's moderate or severe. With fasting headache, it is mild to moderate. And they stated that the patient must have fasted for more than 16 hours, but they now changed the criteria. They said if patient had fasted more than 8 hours, especially nowadays, so that could fulfill the criteria, then the patient may develop headaches, which would resolve after the resumption of food intake. The story or the effect of fasting on headaches is not new. And indeed, if you look back in 1975, when they did a questionnaire on 1,800 patients with migraine or with headaches in general, fasting was the main trigger in about 2/3 of patients. And when we look at those patients who are in the productive years, the fasting component was the main trigger in about 76% of patients. In a study that was done in Greece at a group of people living at the mountains in the Greece, they basically, at that group, they have fasting as part of their culture. And in 80% of them, they developed headaches as a result of fasting. We know that Jews as well do fast, and the headaches as a result of fasting in the Jewish population has been previously stated, and in one of the studies suggested 40% of those who fasted in the Jewish population had developed headaches as compared to the group who did not fast, where 7% of them had developed headaches. In our region, there's one study in Saudi Arabia that have looked at the what we call first day of Ramadan headache. Most of the patients with headaches, they will tell you that especially in the first few days after start fasting with Ramadan, they have what we call severe bad attacks, and that's called first day of headaches. And in their study in Saudi Arabia, 40% had developed that type of headaches as compared to 8% of patients who did not fast in the Saudi Arabia population. We all know that during the month of Ramadan, there's an increasing visit to the emergency room. And in that study, there's increasing visit as related to worsening headaches as compared to other neurological disease states. So if you look at what happened during migraines, so there are some studies, like for instance, this study in Turkey, that had looked at what happened during Ramadan as compared to the months outside Ramadan. And in that study, they showed us there are worsening severity as well as a frequency of attacks, meaning the attacks had become more frequent during the month of Ramadan, and the attack severity become worse during the month of Ramadan as compared to the months outside Ramadan. In another study that was done in Malaysia, had suggested, according to their cohort of 33 subjects who had headaches, they basically found out that 50% of the patient would have worsening headaches. So 50% of the patient had worsening headaches during the month of Ramadan, and about 20% had decreased headaches, and 20% their headache frequency did not change during the month of Ramadan. But remember, 50% had worsening headaches. So if you look at this graph, and if you look here, that during the month of Ramadan, you see there's increased severity as well as a frequency of the attack in the month of Ramadan here as compared to the 2 months before Ramadan and the 1 month after Ramadan. That again, that study was done in Malaysia. However, there's another study that was done in Saudi Arabia that showed actually Ramadan did not make any difference. It did not worsening the attack frequency or severity in that study in Saudi Arabia. So in the literature, there are some studies actually suggesting worsening headaches. Some very few studies suggested no change in the frequency during the month of Ramadan. Now, why patients would have worsening headaches during the month of Ramadan? Well, part of it because of dehydration, part of it because of low blood sugar, hypoglycemia, part of it because of fragmented sleep. Remember what we said during Ramadan, that our sleep-awake cycle will become fragmented, and that could worsen headaches, and part of it related to caffeine withdrawal, and we'll get to that later on. The issue of low blood sugar causing headache is not really well established because there are some controversial issues in the literature that suggest actually hypoglycemia should not cause headaches. And in people with diabetes, when they receive insulin, they develop hypoglycemia. They would not develop headaches as part of their hypoglycemic symptoms. And we know that there is a storage of glucose in the body that should be enough to supply the glucose even with fasting, and that will be sufficient for more than 24 hours after fasting. So there's some controversy in the literature about if it is hypoglycemia would cause seizures. Especially, we know that there are some studies had used the ketogenic diet, the modified Atkins diet to treat migraines. So now we can use modified Atkins diet, we use ketogenic diet to treat migraines, and there are also some studies using low glycemic diet to treat migraines, and it is effective. So probably hypoglycemia is not the only reason, or at least it's not the main reason why patients would have worsening headaches or develop fasting headaches during the month of Ramadan. So what about fragmented sleep. We know that in patients with migraines, the main triggers for their attacks are stress is a big factor. Big factor, stress, and that could happen obviously during Ramadan as well, especially if you have too much work, less sleep, so stress can be a factor, as well as fragmented sleep, staying up late until suhoor, having a couple of hours of sleep, or 3 hours, a few hours of sleep, and then you have to wake up in the morning, especially for those who work, and then come back late in the afternoon, take a nap, and then stay up late until suhoor time. So that disturbance of sleep-awake cycle, that could put our patients during the month of Ramadan to have worsening headaches. Finally, caffeine withdrawal. This is specifically for the caffeine lovers, and I'm actually one of them. The caffeine lovers, or who consume good amount of caffeine, they will definitely may suffer during the month of Ramadan. The reason being, we know that caffeine has an analgesic effect, meaning it reduces pain or treats pain. And indeed, in the old days, when we used to treat migraine, we used to use caffeine as one of the components to treat the migraine attack. And we know that those who regularly use caffeine or even tea, those are at several-fold increased risk of developing first Ramadan headaches as compared to the people who are not heavy caffeine consumer. Now, the big question you may ask yourself, how we can manage migraines or headaches or fasting headaches during the month of Ramadan. We have to emphasize on two components, non-pharmacological component as well as pharmacological treatment, meaning taking medications to treat migraines. So for the therapeutic approach, we rely on prophylactic non-drug treatment or drug therapies. So what we could do in prophylactic non-drug treatment for the caffeine lovers or the regular caffeine consumers, we always advise them a few weeks before the start of Ramadan to start cutting down on caffeine consumption. So we tell them a few weeks before Ramadan start, you can start cutting down on the number of cups you take per day as part of your coffee or tea for that matter. We may also suggest that, especially for those who may not wish to cut down on caffeine before the start of Ramadan, that at suhoor time, take a cup of strong coffee before you start your fasting. And very importantly, for all the migraineurs, for all patients with migraine, you need to avoid all the potential triggers. Again, good hours of sleep as much as possible, good hydration at the time you break your fast, try to not expose yourself to direct sun exposure, minimize your time you spend in front of your computer, laptop, or for the young population in front of their video games, etc., or at least cut down on the number of hours you do that. That would be important to avoid, especially during the month of Ramadan, to try to minimize as much as possible the main triggers for migraine during that month of Ramadan. Other thing that can also help, relaxation technique, yoga, all of these can help to reduce the stress as well as potential of having worsening headaches during the month of Ramadan. Now, what about medications? Obviously, I'm just going to state a few options, and obviously these options you have to discuss with your treating physician, and these can be offered to patients with migraines or for those who had a prior history of having fasting headaches as a result of fasting during the month of Ramadan. One of the options, obviously, to use specific non-steroidal agents or COX-2 inhibitors. Again, you just have to mention to your physician there are options to treat long-acting triptans. These are, again, a class of medication that can be offered to patients, and they can take it at suhoor time. These can prevent having migraines during the month of Ramadan, or you discuss with your physician to start on preventive therapy before the month of Ramadan, meaning a drug that you take on a daily basis or other modes of therapy that would basically help you to go through the month of Ramadan without experiencing any difficulties. The data suggests the efficacy of these medication had been well established in the literature. This is some of the studies that show the effect of COX-2 inhibitor. This is a class of painkillers that have found to be useful in managing migraine headaches or worsening migraines or fasting headaches as a result of fasting. This is from the studies from Yom Kippur headache, which is the result of fasting in the Jewish population, and other studies, as I mentioned earlier, that have used other sorts of medications, including the triptans, which a class of medication we use as a painkiller for patients with migraine. These medications can be used to prevent having migraines as a result of fasting. This is an example of that study that have used the specific triptan or that specific medication to prevent migraines. Other thing to mention as well, emphasize that you may want to discuss this with your physician to start you on preventive treatment, meaning drugs you could use to prevent having worsening attacks before the startup of the month of Ramadan. So let me leave you with final thoughts. Obviously, fasting is an important precipitating factor of headaches in general. Headache sufferers have a higher risk of developing headaches during fasting, meaning you are more likely to have headaches if you had a prior history of headaches as compared to someone who don't have headaches in general. So if you are a headache sufferer, you are more likely to experience worsening headaches or more headaches during the month of Ramadan as compared to those who did not have prior history of headaches. The likelihood of developing fasting headaches increase directly with the duration of the fast, meaning the longer hours of fasting, the more likely you may experience headaches. So the longer hours of fasting, the more you would be exposed or having more likelihood or more chances to develop fasting headaches. So with that, I end, and I'll be very happy to take any questions. Should you have any questions about fasting headaches in general, headaches as a result of fasting during the month of Ramadan, or any questions you may have about fasting or headaches or anything related to headaches in general, regardless of fasting, I'll be very happy to address any of your questions. Thank you very much.
Thank you, Dr. Taoufik, for a very interesting and concise lecture. The chat and discussion has been very active from the very beginning, so we have lots of questions to get through, and I also have some private questions that we'll address a bit later on, so I will just get right to it from the very first one. Can I experience different types of headaches during Ramadan?
As I said, during Ramadan, you may experience 3 types of headaches. You may experience tension type headache, especially for those who had prior history of tension type headaches. You may experience worsening migraine. So for those, especially for those who had a prior history of migraine, they may experience worsening migraine during the month of Ramadan. Or if you had no prior history of headaches, you may experience something called fasting headaches. So that fasting headache is different from migraine headaches, somewhat resembles tension type headache. As I mentioned, it's non-pulsating, diffuse pain. It is different from migraine headaches that occur as a result of fasting by itself. It's not migraine related. It is the direct effect of fasting itself. Or you may experience combination. So patients with migraine headaches, they may experience worsening migraines, and they may also experience fasting headaches, and occasionally they may also have tension type headaches. So you may have experienced 3 types of headaches during the month of Ramadan. But more often what we see, worsening migraines and also fasting headaches on the top.
Okay, thank you. Next question is, can I still take my medication properly during fasting?
Well, it depends which medications you are referring to. Is it you're referring to a preventive treatment, or you're referring to painkillers? For the painkiller, well, it's not specific, but let me say it, in case you are referring to painkiller, obviously you cannot take painkillers by mouth during fasting, because that will break your fasting. But what you can do, you can take a specific painkiller that can be injected subcutaneously. That would not break your fast. You can certainly do that if you have any attack during the month of Ramadan, and you can use subcutaneous injection. But for other treatment, let's say if you are using medications for prevention, if you are using by oral medications, obviously you cannot take it during the time of fasting, but you can take it after you break your fasting, meaning at iftar, definitely before dawn. You can do that. Or if you're using other treatment options such as the subcutaneous injections, which are available nowadays, these would not break your fasting. You can take it while you're fasting or even outside the fasting hours. These would not break your fasting. These are anyway used on a monthly basis. So if it happens you have to take it, you can take it. It would not break your fasting.
I only seem to get headaches during fasting. Should I see a doctor?
Well, again, fasting headaches is not uncommon. We had people that they don't have headaches outside Ramadan, but they do have fasting headaches only as a result of fasting. Well, do you need to see a doctor? Well, it depends. If you are bothered by these headaches, and obviously you are, otherwise you wouldn't have mentioned it, then I would suggest you see a doctor, but the doctor would definitely help you find ways to fast without any problem during the month of Ramadan. Because the idea behind this, we want to make sure that our people fast without experiencing any difficulties during the month of Ramadan, not having headaches, any type of headaches, and they will have a comfortable fasting during the whole month of Ramadan. So certainly I would advise that patient or that whether he or she to go and visit their physician or neurologist, and they will discuss with them some options that would help them fast without any problems.
Thank you. I have read that fatty foods are good to eat to help. Is this true?
Well, the issue of diet and migraines had been well studied. And as I mentioned earlier, there are some studies that suggest that ketogenic diet, which is again heavy in fats and low in sugar, or modified Atkins diet, can be helpful to treat migraines. So there are some data to support that mode of treatment in managing patients with migraines. And there is some link as well between obesity or heavy weight and migraines. And there are some studies suggest that if you lose your weight, that could also have a better control to your migraines. So there are some link there, but I would not obviously advise you to go and on these diet just for the sake of treating your migraines, because nowadays we have better options to treat migraines. But if we are out of options, we are limited of options, or whatever we treat is not working, then obviously modified Atkins diet or ketogenic diet can be helpful in these limited cases.
Okay, thank you. There are a number of questions regarding caffeine and coffee, so I thought I would group them into one piece, and they're all kind of linked anyway. So this one person says, "Can I take regular painkillers to help my headaches? They're so bad with the caffeine withdrawals." Then another person actually then mentioned, "Is it wise to have decaf or a substitute to help come down and relieve those withdrawals before Ramadan starts?" And another person says, "Caffeine during sahur makes me unable to sleep, so worsens the situation." So I know you covered caffeine quite extensively, but those are some of the comments regarding that. So would you mind to make any comments with regards to those?
So caffeine withdrawal is certainly a difficult one to tackle, obviously, especially for heavy caffeine consumers. And when Ramadan comes, if you do not approach this early enough, you may have some difficulties during the month of Ramadan. I always advise my patients, especially for the heavy caffeine consumer, and I include myself in that category because I'm a caffeine lover, to start to cut down on your coffee a few weeks before Ramadan starts. One of the ways, obviously, to start using decaf is certainly one of the options, because in the decaf, there is some amount of caffeine, but the amount would be too small. So you would not experience any caffeine withdrawal during the month of Ramadan. So you can cut down on your coffee by substituting the regular coffee with decaf, or by or using, for instance, the green tea, because green tea has some caffeine, but very limited amount of caffeine, a few weeks before the Ramadan starts. And if, let's say, you experience some headaches as a result of caffeine withdrawal, certainly painkillers can be helpful to treat these attacks, at least for the as a result of the caffeine withdrawal. Now, yes, I had suggested that you can use strong coffee at suhoor time. I understand that for some people, using coffee at suhoor time may impair their sleep because it has alerting effect. But for others, it may work well. So it depends on you. I mean, I take it personally. I may take my strong coffee and sleep afterwards without difficulties. But for some, they obviously may not be able to sleep after their strong coffee. I would suggest that approach of using strong coffee at suhoor time, especially for those who could not be affected by the coffee, or if people would have to go on to work right after suhoor time, because suhoor time these days is going to be close to 4:30, 5 o'clock, and they may have to go to work 6 or 7 in the morning. So you may just have your coffee and then resume your day early, obviously. Then you don't have to worry about the strong effect of coffee in terms of not allowing you to sleep. But that's one of the options, obviously.
Thank you for the clarifications there. I will move to some private questions now. If anybody in the public chat wishes to ask some more questions, please feel free to do so. One private question is, I find it difficult when fasting coincides with my menstrual cycle. Any advice? Well,
again, menstrual cycle is the main trigger for migraines. And we know that for women, they tend to have worsening attacks of migraine either before, during, or after the cycle. So now if you have that factor and you have fasting on the top, that certainly would put that patient, or a woman in general, at risk of having worsening attacks. So what we could do, again, provided that their cycle is regular, I would encourage that patient to discuss this with their physician, to use some preventive therapy before the cycle kicks in, and after the cycle is over by a few days, to try to prevent having worsening attacks during that time frame. So use medication. Again, that obviously had to be done with consultation with their physician, to take medication a few days before their expected cycle, during the cycle, and a few days thereafter, to try to minimize the risk of having worsening attacks as a result of menstruation, as well as obviously with fasting on the top.
Thank you. Next private question how severe do the headaches have to become to see a doctor during fasting?
Well, it depends how much you are bothered by the headaches. It's not the severity, but how much you are troubled by the headaches. In other words, if the headaches interfere with your ability to carry on with your duties, with your social life, with your work, then yes, you have to see a physician. So any headache that interfere with your routine deserve a visit to your physician.
Do you have any advice on how to avoid fatigue, as this seems to be my main trigger during fasting and I cannot avoid it?
Well, the best way to avoid fatigue, again, good hydration, so good fluids after you break your fast, a good balanced food. It's very important after you break your fast. Do your very best to maintain regular hours of sleep, because I mentioned earlier the biggest challenge we face during the month of Ramadan, that fragmented sleep. Do your very best to keep a well-balanced sleep cycle. That is very important. And again, try to minimize the direct sun exposure. This would be the best advice I would have for that patient.
And the final private question we have, perhaps more on a spiritual level, this person is asking is, can prayer help alleviate migraine?
Absolutely, it does. Again, remember we had mentioned that the biofeedback, mindfulness technique, etc. Anything make you feeling relaxed, and obviously prayer can be one of the things that make you feel relaxed. That certainly would help reduce the amount of pain in general, as well as the severity of the headache itself. But that obviously has to be taken in conjunction with other measures that you have to follow that would help you reduce your headache and pain in general.
Okay, thank you. There are some more public questions that have come in. I believe these are more from healthcare professionals, it would appear. Hi, I'm usually treating my migraine patients with sumatriptan injections. So can this be used during fasting?
Yes, they can. Sub-Q would not break your fast. Yes.
There are some questions with regards to specific drug medications, which we will not be discussing on this webinar. And then person here saying there's instructions for a person with DM during fasting because it can cause hypoglycemia and headache also. So do you have any instructions for a person with DM during fasting because it can cause hypoglycemia and headache also?
Well, I think for patients with diabetes in general, it's best to have your diabetes well controlled, especially before you attempt to fast. And I would advise you to check with your endocrinologist, with your diabetes doctor, if you are allowed to fast, because not every patient with diabetes should be allowed to fast. That something had to be discussed with your treating physician before you can start your fasting.
Thank you. There are no further questions as of yet on the public or private forum. We will allow 1 more minute if anybody wishes to ask a question for Dr. Taoufik. Now is the time, so please feel free to write on the chat bar. In the meantime, while you're thinking of your final questions, let's say that we have 2 more webinars in the series coming up. They will be after Ramadan. The 4th one will be on the 26th of May, and that will be focusing on women's issues. As Dr. Taoufik has mentioned already, it's a very common issue, so we encourage you to attend that. And then the final webinar will be June 16th, and that will be focusing on psychiatric disorders again. So 2 very important topics to finish on. So please save the dates for those in your calendar. I don't see any more questions at this minute. So Dr. Taoufik, if you have any kind of take-home messages you'd like to give to the audience for today, and then if there's no more questions after that, we will end the webinar.
Again, I'd like to thank you all for attending this webinar. I hope it was helpful, informative. I wish you all happy Ramadan. Enjoy it to your very best, but do your very best as well to take all the precautionary measures in order to have good, healthy fasting. Thank you all.
Thank you. Oh, there was one final question. I believe you may have covered it in one of your slides, but perhaps this person did not see it. Do you recommend to follow the keto diet to reduce migraine during Ramadan?
Again, if you want to do this keto diet, I would advise you do it outside Ramadan. I wouldn't try anything during the month of Ramadan because it's already a stressful month and you're going to go through the fasting itself. So if you want to explore keto diet, you may do it outside the Ramadan to begin with. Keto diet, modified Atkins diet, ketogenic diet had certainly been used to treat migraines, but I would not make it our first attempt to treatment. I would try other measures first. If these measures fail to control the migraines, then you can revert to ketogenic diet or modified Atkins diet. And these, again, have been extensively studied in the literature with some positive results. But I repeat, I would not revert to these measures unless I have exhausted other options and these options had failed to treat migraine. Then you can obviously try the modified Atkins or ketogenic diet, but certainly I would not go for these diet, especially during the month of Ramadan. I would do it outside Ramadan first, see how it goes, and then you can, if it works, you can explore it during the month of Ramadan.
Thank you, Dr. Taoufik. And for any patients that wish to see you, visit you, your clinic, or any one of your doctors, how can they get in touch and make an appointment?
Just call 800 ACPN and book an appointment, and I'll be more than happy to see you, welcome you, and address any of your questions or concerns.
Thank you all. Wishing you a blessed Ramadan to all that's attending, and we shall see you after Ramadan for the next series. Good night all.
Good night. Ramadan Kareem.